Hi, I'm here to teach you about using a PCA pump, also known as a patient control analgesia pump. This is the pump that we use at the Mount Sinai system. Things that you need to know before you start a pump are the necessary supplies and equipment that you will need. The first thing is that the pump comes in a lock box that has a lock there. You're gonna need tubing, and this is the tubing for the PCA pump. It has what we call a cassette, and it has the part to spike a bag of your medication and what you connect to the patient. In addition to that, you're always going to need four AA batteries. Every time you put a patient in a PCA pump, you always get four new batteries. You're going to need a key, which is stored in the Pyxis, which is our medication storage units in every floor. And you're going to need a code for the machine. You'll get that code when you remove the key. One of the things that is important to remember is that even though a patient is on a PCA pump and they're controlling their own pain medication, you're responsible for continuing to document how accurate and how well their medication protocol is or their pain protocol is. Therefore, you always continue to assess for pain on a scale from 0 to 10. For patients who are not able to self-report, they may have advanced dementia, you're going to use a pain ad scale. And if you're in the ICUs, you are going to use an ICU specific pain assessment score. An interpreter is going to be needed if you are need to explain to the patient what's going on, and an individual assessment of the patient is necessary to understand if they have a history of drug use, because based on their history, the dosage of medication will need to be increased or decreased. So to initiate any PCA protocol, it's a 2 RN process. 2 registered nurses must co-sign that they set up the machine and that the amounts of medication or opioids that are in the bags are correct. Every time there's a shift change, 2 nurses need to verify. So the ongoing RN and the incoming RN need to meet together at the bedside, go over the PCA pump, make sure that the settings are correct, and co-sign it in the MAR in Epic. If there's any dose changes, same protocol applies. 2 nurses will need to verify that order. And in addition, if you need to discontinue a PCA, same. 2 nurses are responsible for documenting it, especially because there might be waste medication, and that is a 2 RN registered nurse process. Okay, so I'm gonna show you how to set up a PCA. In our training video, the code for the PCA is 007. In the floor, the code is different. When you come in to the education department to do the hands-on training so you could get more comfortable with the machine, you are going to use code 000. So one of the things that you need to know about the machine is that you need to know what medication you're given, if there's a continuous rate, if there's a demand dose, what the 1 hour delivery limit is, and if there's any type of clinician doses. Those are your breakthrough pain medication, and always when initiating PCA therapy, you want to prime the pump using the pump. You don't want to prime the tubing before you connect it to the machine. And when you are to discontinue PCA, or if a patient is going to a procedural area or the operating room or MRI, you need to do a handoff with a receiving RN in that area. Patients are monitored for respiratory function, pain level, and sedation level. When you initiate a PCA pump, it gets done every 1 hour for 2 hours, and then it's every 4 hours. If there is any Narcan administered, that PCA pump is going to be sequestered if the patient was over medicated. There might be something wrong with the patient, with the machine. If the patient was doing well and then a few hours later the patient is unconscious, maybe something is wrong with the machine, so we need to investigate any issues of oversedation with a PCA pump. So engineering will come take the pump, but pharmacy needs to be made aware. You are responsible to document the volume infused and the volume remaining. You need to look at the report screens about the doses that the patient attempted to get and how many doses the patient actually got. In addition, you want to document the clinician boluses. The total volume infused is important, and also how much fluid or medication is left in the bag. Again, a pain assessment and a reassessment is a policy of the Mount Sinai Health System, and anytime you give breakthrough medication, clinician boluses, you need to do an assessment of pain and then come back 10 minutes later and reassess pain for that patient. It's always important to remind visitors that if they are visiting a patient who has a PCA pump, that only the patient should press the PCA pump and not the family member. In addition, if they are not compliant with that, you need to escalate it via the chain of command, your supervisor immediately, so that we could assess what the situation is and take further action if need be. In addition, one thing that I always like to tell patients when I initiate them on a PCA pump is that this, because it's patient control, there's a remote control. When the light turns green, that means that it's ready to infuse and a dose is due at that time. Some nurses will tell the patient to only press the button when the green light is on. What happens at that point is that if I'm in a level of 10 out of 10 pain right now, and I don't have access because I am not due for a dose, I'm not going to press the button. I'm going to wait 8 minutes before I self-medicate myself. But if you tell the patient, press it anytime you have pain, if right now I'm experiencing 10 out of 10 pain, I'm going to press it a lot of times, thinking that I might be getting a dose. But with that said, what it's going to do is when you document the attempts, it's going to tell the clinician ordering the PCA pump if the patient is asking for a lot of pain medication, and that leads to hopefully an increase of pain medication and dosage change. So it's very important to tell the patients to click the button whenever they're in pain. So with that said, we're going to get started. I took my key out of the out of the Pyxis machine, and I'm going to unlock the pump. When you unlock the pump, you're going to open it, and the top of it should be open. If you look inside, it shows you the positioning of the batteries. That's the first thing that you do. So it always goes from left to right with opposite polarizing parts. What you're gonna do next is you're gonna press down, and you need to turn the lock. If you cannot do it with your hand, you could do it with the actual key. Once that's done, the next thing that's important for you